Hello, ladies and gentlemen. Greetings from Indonesia. My name is Meldasari Said. I'm with my two colleagues, Ms. Laila Reviana Said and Ms. Sri Harini, writing paper together with title The Placement Evaluation of Health Workers who function as promotive and preventive personnel in the Banjarbaru City Health Center, or we used to call it as Puskesmas. We thank you for the opportunity for this presentation virtually on this international conference. Well, for the beginning, the Indonesian health programs focuses on first, raising awareness of a healthy paradigm, second, strengthening health services, and third, implementation of national health insurance. Two of three focuses on curative function more than preventive. Also, since the national health insurance has given free medical treatments for the poor, makes the Puskesmas busy with the curative actions than the preventive ones. We have to understand that at the Puskesmas, the people who carry out public health efforts, which is health promotion and disease prevention programs, are the public health workers, environmental health workers, and nutrition workers. Based on the Indonesian Law Number 36 of 2014 concerning health workers, these are many occupations that included in public health effort function, such as epidemiologists, health promoters, occupational health guides, and so on. Based on that explanation, the elaboration of which health workers perform their disease prevention function is unclear. On what type of health workers are appropriate to be placed at the Puskesmas? Both the Minister of Health Regulation and the South Kalimantan Regional Regulation did not elaborate on the appropriate public health and welfare workforce to be placed in the Puskesmas. It's giving rise to different interpretations at the Puskesmas. As a result, there are differences in the implementation of the placement of health workers who carry out the function of health promotion and disease prevention in each health center in the city of Banjarbaru. This study aims to evaluate the placement of health workers who function as promoters of health and disease prevention in Indonesian health centers or Puskesmas. This study took place at Banjarbaru City, the province of South Kalimantan. Interviews were conducted with selected Puskesmas heads to obtain data of the performance of health workers in the field. As a complement to informants in exploring designs or policy standards, interviews were also conducted with several officials in charge of staffing and surveillance issues at the Banjarbaru City Health Office. This research uses a qualitative approach with a policy evaluation research method using Profus discrepancy evaluation model. The data obtained through in-depth interviews using open-ended questions, observation to gain the form of a picture in the field, and document reviews. The focus group discussion, or FGD, were held between several officials in the Banjarbaru City Health Service, aims to get a common view to conclude the problem and design recommendations that are in line with the findings of the researcher. The research design follows the path or steps specified in the Profus discrepancy evaluation model, or DEM. In implementing them, a series of linear evaluation processes starting from step 1, namely developing policy design and standards, then the second step, designing evaluation using them, followed by the third step of capturing data on policy performance, the fourth step, identifying discrepancy between performance and standards, and the fifth step determines the reasons for discrepancy and ends in the sixth step, which is to arrange activities to eliminate discrepancies. In identifying discrepancies at fourth step is done by comparing the data in step 1 with the data in step 3. Discrepancies can be determined through analysis of three aspects of policy, namely input, process, output, at the stages of policy development. The stages of policy development consist of stage 1, the definition or design of the policy. In this case, seen from the planning of human resources at the Puskesmas. Stage 2, the installation of policies are often identified with input to policies. In this case, seen from the recruitment carried out at the Puskesmas. Stage 3, the policy process, in this case, is seen from the selection process of health workers in the Puskesmas. Stage 4, the expected product or output as the outcome of the policy, in this case, reviews the placement of promotive and preventive health workers in the Puskesmas. And stage 5, the benefits derived from the policies implemented, in this case, examine the empowerment carried out at the Puskesmas. As explained earlier, the research design follows the steps of them from Provus, consisting of planning, recruitment, selection, placement, and empowerment of health human resources at Banjarbaru City Health Center. In terms of planning, the informants simply complained about the inadequacy of the plan formation of health workers in the Puskesmas following regulation of the Indonesian Minister of Health. With a minimum amount of personnel, complained of being unable to run all programs optimally. Some period of service for curative and prevention campaigns, making health workers felt overloaded, but the workload analysis doesn't show the load justification. In terms of recruitment, from several officials of the Banjarbaru Health Office told that it was not yet clear which community health workers were needed at the Puskesmas. They realized that the position of epidemiologists and health promoters should be in the Puskesmas. Even reproductive experts, according to them, should also be in the Puskesmas. It's just that the placement for all these occupations does not yet exist. Scheduled central government recruitment limiting vacancy fulfillment, and no available budget from local Puskesmas to self-finance local recruit. It is added by the mayor of Banjarbaru, who has issued a regulation prohibiting the recruitment of local contract employees, so that employee shortages can only be submitted once a year. The needs of the epidemiologist's position are also felt urgent. It's just that due to the quota of employee requests, the priority of employee requests is for health promoter first. At present, the Puskesmas can only receive apprentices from colleges or university graduates in the health sector. They are treated as voluntary workers with no payment at all. In terms of selection, related to recruitment that depends on the agenda of the central government, the selection of recruitment for health workers at the Puskesmas also follows the methods carried out by the central government. On the side of the Puskesmas itself, there is no more selection, including for apprentices, no Drew selection. Usually, those received through interns are close relatives of people who work at the Puskesmas. Ironically, the apprentices who took the civil servant test all failed. The reason being that the passing grade set by the central government was too high. Many Puskesmas in the province of South Kalimantan did not receive new health workers because of the low number of candidates that passed the test for qualified civil servants to be placed in Puskesmas. In terms of placement, functionally, all 9 types of health workers required at the Puskesmas are met. But in person, some functions are double. Midwives and nurses generally carry out multiple positions as public health and environmental health personnel, each responsible for a program. Besides, they also have a double task as treasurer who manages the financial administration of Puskesmas programs. Some others are also double tasked as administrative staff and medical records officer. Ironically, this dual position does not affect the career advancement and compensation of these health workers. The position that double formally has no legal basis, so it is not recognized in the functional position credit value assessment. Health workers who hold double position often complain to the heads of their respective Puskesmas on time management issues. Curative services that are usually carried out in Puskesmas buildings are often timed to coincide with preventive services, such as immunization, elderly services, and others. So, the workload in the morning were felt very crowded for health workers. Indoor services, indoor services are also understaffed, especially with the free medical treatment policy. Community visits to the Puskesmas have increased. In terms of empowerment, with the dual positions as the Puskesmas, the actual training needs are for the health workers who have double job, because their new positions outside their competencies. But the fact is that Puskesmas only participate in training programs that have been made by the Health Service Office and the Health Training Agency based on the budget of the agency. Puskesmas do not have a special budget for conducting internal training. As explained earlier, having a double position does not affect career and health worker compensation. The double position does not become an additional point for assessment in the context of promotion because, based on the regulation, one health worker may only assume one functional position, so that this dual position also does not affect compensation. If the health worker wants his or her new functional position recognized, then he or she can take appropriate formal education, yet at personal expense. From these findings, it was concluded that there are discrepancies between standards and performance in the field. In this case, promotive and preventive programs in the Banjarbaru City Health Center have been many, where these programs are in line with policies or standards set by the government. It's just that there is no placement to be held specifically by functional personnel in public health efforts. Thus, this function is carried out in a dual position by the midwife and or nurse. As a result, promotive and preventive programs are carried out part-time because they are carried out by health workers who are not competent in this field. According to Dessler, incorrect placement can result in poor employees' performance. It is also confirmed by Zani and Fadila's study that stated the lack of funds and the lack of health workers resulted in some planned promotive and promotional activities not being carried out on a scheduled basis, some even not being carried out at all. For this reason, a shortcut that can be done is to equip health workers who hold double positions with appropriate competencies according to their field of work. The fulfillment of minimum competency standards by the government needs to be done in this competitive world, where public sector organizations need to achieve their goals by providing effective and efficient services to the community, so that skilled workers are needed. To the nearest future, the Banjarbaru City Health Office should take the initiative to conduct a job analysis in parallel with the workload analysis at the Puskesmas to optimize the Puskesmas function in carrying out public health efforts through health promotion and disease prevention. This is in line with the thinking of Wakefield et al., which states that health services must start from good health workforce planning. For this reason, in the HR planning process before recruitment, it is necessary to design and analyze the positions. That's all of our presentations. We thank you for your kind attention. If you have any questions or comments, please do not hesitate to contact me through my email address, meldasite75@gmail.com. Once again, thank you for your kind attention. Bye.